Show. I'm Dr. Kay Solar in the house with Hurricane Betsy Barnes, who is still continuing with that name of birthday Betsy Barnes the entire month. She's keeping the celebration going. And we're really excited to have Dr. Ralph Dauterive, who is the Vice President of Medical Affairs at Ochsner Medical Center here in Baton Rouge. Been a long-term OBGYN in the community here. And thank you for coming on, because I know that lots of folks have questions, not just about the COVID vaccine, but about really what is going on in our hospitals, because they get their information from social media, and they're like, what's real and what's not?
From strangers, friends, and everybody else.
Yeah.
A lot of
Exactly.
rumors.
Exactly.
So, I mean, what do you want to tackle first? I think, because there's so much going on. Why don't we start with what is actually going on in the hospitals? I mean, are we truly overloaded? Because when you talk to people, they go, "Oh, are those numbers, just to scare us? What's really going there?" Because they're not there unless they've had somebody that's been in the hospital or presented. So I think that's a question in people's minds.
Well, so we'll start off with what's going on in the hospital middle of August.
Yeah.
We're into the fourth surge. Louisiana was blessed with the first surge because we got caught with Mardi Gras and the way we live our lives. And so then the rest of the country kind of joined us with the second surge, and then we had a third surge, which was sort of earlier in this year. And we sort of thought that might be it because we had a vaccine and we were going to get out of this. But not enough people got vaccinated. And the Delta variant hit the United States, and then we got caught in this surge. And this surge hit us quicker than the first surge. The spike on this surge is dramatic, and the peak is going to be higher than any previous surge. So we're back into daily numbers that we were experiencing when everybody was interested in what the daily numbers were. Well, they're worse now than they were when we were worried about it. Louisiana was one of the leading states in this surge, and coincidentally, we were the leading state in not getting vaccinated. And so if you wanted to look for the proof of the vaccine and how it would be effective, this surge is proving it, because this is the unvaccinated surge. This is the surge that we could have prevented.
So when we see this surge and we're looking at those daily numbers that folks used to follow, are we seeing spikes in not just the number of cases, but the number of hospitalizations, the number of people on vents, and the number of deaths?
Absolutely. So positive tests are the leading indicator, and the positive test in the surrounding parishes in Louisiana and in East Baton Rouge were above 22%. So if somebody had symptoms of COVID and they went in to get tested, we're talking 22% positivity rate. I saw pediatric data just recently. Used to be pediatric in January, through the beginning of the year. Pediatric positivity rates were 3.5%. Today they're being reported out at 23, 24%. So that's 1/4 of the kids that have a runny nose, COVID-like symptoms, come in, get tested, and we have a positive test. And some of the argument would be, well, we don't do enough tests, so that's why it's so positive. But that was the old argument. That was in the past. We do lots of tests now. The number of tests that we do has gone up, and the percent positive has gone up. So that is one of the leading indicators. And that we saw that happening, and we saw more testing being done, and right after that, the numbers in the hospital started coming back up. There were a couple of times early in this year we actually discharged the last COVID patient from the hospital. We were so excited, and we had almost nobody in the hospital in the ICU with COVID. We were coming back down to normal numbers.
Right.
And we thought, okay, this is what it's going to be like. This will be the new norm.
And I think that's what we thought, because we were just before this hit feeling like we were getting our heads up out of the sand.
Exactly.
And then all of a sudden, it's like one of those whack-a-moles, you're back, down there.
And the numbers went up in the emergency room, and the numbers in the hospital started to rise. And we were thinking, well, we have treatments now, so maybe we can prevent this. And but there's so many more people infected now and the Delta variant is a much more aggressive variant of the virus. So that's a serious issue, and we still had people then getting worse on all the things that we knew that we thought we were better at treating. So our peak numbers at Ochsner and Baton Rouge were 44, 45 patients with COVID. And at one point we had maybe 16, 17 patients on the ventilators. Today we're at 85 patients in the hospital with COVID, and our 20-bed ICU is filled with COVID patients, and we're overflowing down other halls with ICU capacity and into our operating room with the ICU. So we have about 32 intensive care patients in a hospital that's geared to take care of 20.
Wow. So,
and that goes on everywhere. That's happening at all the hospitals in the
so
Baton
when
Rouge
people
area.
think, well, they have regular ICU patients, they're like got surgeries, they got those people. That's not really why the ICUs are full. These are COVID patients filling that.
Exactly. Yeah.
And,
it's serious. And it's not like we can't take care of things that are happening. We can, and we do. But we're not going to do a knee arthroscopy right now if you need one, but we're going to deliver your baby, and if you're bleeding, we're going to do a hysterectomy.
We're going to take care of your
emergency
surgical cases, but your elective cases, just like with the first surge that ended up, getting canceled. Those things are being canceled because there's truly not enough beds if you had an emergency. You need those emergency people and the COVID people for those.
And you need
ICU
nurses.
beds. And you need nurses to take care of them. And some of those folks are getting sick even though they were vaccinated and just have to be out for 14 days. Is that correct?
That's absolute. And our hospital staff got vaccinated at a slightly higher rate than the rest of the community, but our hospital staff lives in the community just like everybody else. And we were sitting in a lot of the hospitals after the first wave of vaccination was offered. We were about 40-45% vaccinated. Mm-hmm. The physicians tended to get vaccinated at higher rates into the 90-95% range, and the nurses were sitting at about 50%, and some of the other hospital workers and staff were at 30 and 35%.
Right.
The population in Louisiana was sitting at 35%. We're creeping up. We're making some headway with this. Mm-hmm. And we've been a real push at Ochsner and the other hospitals to, get people to get vaccinated and come to work. Our Lady of the Lake is making a move to go with mandatory vaccination before the emergency order is lifted. We are going with a testing protocol that'll start in the next 2 weeks, where if you're not vaccinated, it'll be required to have weekly testing.
Weekly testing.
And we just passed out these beautiful green lanyards with green holders for your ID, and you're required to wear an ID in a hospital, so everybody has to wear it. And the people who are vaccinated now will be identified with their green lanyards.
Well, when you spoke to those statistics, I think, a lot of time your nursing population, a lot of them are young nurses, and as Betsy was asking me earlier, having relatives that are young and stuff, a lot of them have that fear because they've seen things on Facebook on stuff for the fear of infertility long term
or birth defects later or something like that.
So can you speak on that for young women, because I think that's some of the delay in young women and young women
I agree
healthcare workers.
And I actually found out about this from a young woman healthcare worker. When we got the vaccine available, I started talking to the nursing staff in the surgical areas, and she said, well, Dr. Dauterive, I'm not comfortable with this. And she told me she was worried about the fertility side of it. And I just looked at her like, well, I haven't heard that. Where did you hear that? And of course she picked it up on Facebook or the internet and some source. And so I spent about 15 to 20 minutes, because as you might remember, turnover time can be slow sometimes. So I had a little dead time.
Yeah.
And went to Up to Date, went and researched it, talked to my infection control specialist, and I said, where is this coming from? And that fear of fertility being affected comes from a theory that the DNA sequencing of the part of the virus that the antibody is going to target had something in common with the placenta. And it turned out to be a 4% allele sequence commonality, which is detailed information, I know, but it's a part of it's part of the DNA. For a virus to work, the antibody has to have almost a 96% commonality. 4% doesn't do it. If all we needed was 4%, we could make vaccines for everything, but it requires much more specific. So that was a theory that was never proven. It was just a thought by one of the Pfizer scientists, and it got out, and it just never got proven. When you look at the data from the 30,000 people that were vaccinated in the early trials, people got pregnant. People were pregnant. And there was no increase in miscarriages and no increase in fertility issues. And now that we've vaccinated millions of people, we're not seeing any increase in the miscarriage rate and no increase in the fertility rate. So those are the things that we use the data to tell us the true story about what we need to be afraid of. And infertility is not one of our fears. Mm-hmm. People that have gotten pregnant and have received the vaccine have done very well. And we recommend it strongly.
And we need to come back and talk about that because people are concerned about birth defects later on. So we'll be right back with Rocket Right with Dr. Kay Solar, talking with Dr. Dauterive, Dr. Ralph Dauterive, who's an OBGYN with Ochsner Medical Center. And we're looking forward to hanging and having some more answers.
Yeah, we got a lot more questions. Let's stay put.
My biggest concern was my family and being able to see me come home every day and know everything is going to be okay. I felt comfortable that I was being treated by some of the best. There were some scary points along the way, but it's just kind of like been a little blip in the road.
Money, wellness, fun. Rocket Right Radio takes you all across Louisiana and the nation with guests who live life to the fullest.
I'm Hurricane Betsy Barnes.
I'm Dr. Kay Solar.
You're going to love it.
Join us every week when we cover
everything under the sun.
Live and learn with the Wright sisters.
Politics,
health,
music and entertainment,
local agnet.
Rocket Right Radio. You're going to love it.
Whitetail Properties is not your average real estate company. Land specialist and MSU alum Jeff Taylor in Mississippi and LSU fan realtor Cade Taylor have teamed up. Their sole purpose is uniting buyers and sellers of recreational land. If you're interested in hunting, ranch, investment, and timber properties, Whitetail Properties experts have the right real estate for you. Call Jeff Taylor, 601-248-9433, or Cade Taylor, 225-719-0495, or visit whitetailproperties.com.
At Hightower Dental Concepts, we take a compassionate approach to family dentistry. Our goal is to make your dental experience comfortable and informative so you can make the best dental care decisions for you and your family. We're welcoming new patients to our dental family at Essen & Perkins, and we look forward to meeting you soon at Hightower Dental Concepts. Call us today at 769-0031 or request your appointment at info@dentalconceptsbr.com.
Young women are joining a movement to educate voters. Why? The need to represent our conservative and moderate values has never been more important. The values that made our nation the superpower it is. If you work, are in college, have children, every decision made at Louisiana State Capitol and City Council meetings impacts your wallet, your home, education, student loans, and everyday life. Become informed and involved through the LFRW Young Women's Initiative across Louisiana. Public policy impacts you and your family. Check out the Young Women's Initiative by emailing lfrw region1vp@gmail.com or call 504-382-3474. We look forward to talking to you soon.
There's a joy of life you'll find only in Louisiana. A spirit of celebration that takes your senses places they've never been before. Where expressions of joy are an art form and our way of life. Where an abundance of good food, good times, and great music means there's more than enough to go around. Come one, come y'all. Come feed your soul in Louisiana. I'm John Goodman, inviting you to visit louisianatravel.com and plan your getaway today.
Back with the Rocket Right Show. I'm Dr. Kay Solar in the house with Hurricane Betsy Barnes, and we're continuing our discussion with Dr. Ralph Dauterive, who is the Vice President of Medical Affairs at Ochsner Medical Center here in Baton Rouge.
And we're peppering him with questions. We have lots of questions, and he's got great answers.
Well, because lots of people have questions, and they feel like they've really been having to discern the truth, because there's all these battles on Facebook and even in the media as to like vaccinate, not vaccinate, what's the real and what's not real. And so I appreciate you joining us to talk through some of those things. And we were talking about the concerns of young women as far as their fertility,
because this test
and issues with future pregnancies.
The FDA approval and all, the emergency approval was given with so few years of research, or so that's what we thought.
And yet the messenger RNA delivery system that are in Moderna and Pfizer, which is the main core of the vaccines in the United States, this delivery system is not brand new. It's not the delivery system that's new. It's been around since your previous guest said, since in the early 1990s. Moderna has had the concept. They just have not had the reason to develop it for the types of vaccines that we were given. Mm-hmm. So, as opposed to killing a virus and then growing the killed virus so that we could inject it like traditional vaccines were given years and years and years, this is a totally different concept where your cells are sort of taught to make the antibody that's necessary to fight off the virus. So we could restructure the antibody we knew what the antibody needed to look like very quickly because of gene sequencing. And so we knew exactly what we were fighting. Then you had to roll out and really get quick about developing the vaccine. Is it safe in humans? Is it effective in humans? And then can we make it on a broad scale and vaccinate 300 million people? I mean, that was a huge task. Yeah. And I think we did a nice job with that. The first studies that were done, imagine 30,000 people engaged in a double-blind study over a period of a couple of months.
Right.
I mean, just to get people to volunteer for a study like that was amazing. Yeah. And then we rolled out that vaccine and got the over 70 crowd vaccinated like that.
Right.
I mean, we did what we were begging for vaccine in the state of Louisiana. Our governor did a great job of bringing it in. And then when we rolled it out to the rest of the community, I just thought our biggest problem would be finding a place to give it to people, that people would just come clamoring in, and it just slowed down.
Right. Yeah. And I think that a lot of those were like fears that then started coming out with that on social media, because initially, people were like going, I want to get in and I want to get my vaccine and I can't because I don't have the like risk factors and whatever.
Yeah,
but then when it was available for everyone, then there was surplus. It was going bad. They were like dumping, the vaccine.
And the other thing too, don't you think that the media and the sensationalism and the clamor for ratings and all of that has just put things out that has made people more fearful. Now people are getting very serious about making sure they have the truth, and that's why we wanted to have you.
I agree.
Because we wanted people to hear the truth so that they feel comfortable making the decision for themselves. And
people worry about they worry about it's being pushed down on. This recommendation comes, I'm not too sure, or am I really at risk for getting COVID? Because
it's continual messaging that's unusual.
Well, so we do feel it's safe, and the history of vaccines would sort of indicate that. Short-term complications from vaccines you tend to see, because it's sort of a short-term reaction that you get. But we have no major data showing us that any vaccines cause long-term problems. Mm-hmm. If it wasn't for, we all got vaccinated for the major problems that we're seeing in the 30s and the 40s, when we were young.
Yeah, but when
didn't
we got
think twice about
vaccinated,
it.
we had fewer vaccinations than they have now. There's so
Exactly.
many more
and
that children and babies are
Right.
given now.
I
And
don't
people
think it
get
was-
concerned.
And it wasn't as politicized.
Right.
I think
that has been a
that's
huge issue.
been the big thing with this. That's
So if we take the
know.
politics out and we talk strictly about health care, you would recommend that people take very seriously the opportunity to get the vaccination.
I think the governor said it very well the other day. You trust your doctor to deliver your baby. You trust your doctor to take care of your heart disease. You trust your doctor to take care of your hypertension. Trust them when they tell you, take this vaccine. Because there are very few physicians in the United States that are saying don't take the vaccine.
Right.
And if you see the people that die of this, and we talked about what's going on in the hospital now, the other scary part about what's going on in the hospital with this one is people under 55 are in the hospital on ventilators, and there are some people in the hospital that don't have the typical risk factors that we were seeing in these first phases.
Right.
They're not obese, and they don't have diabetes, and they don't have the typical things that are older aged patients. And is that because those people all got vaccinated and now these are the people that are being infected? And the other reason to take that vaccine is you've got to protect the rest of the community, because with what we're seeing with the Delta virus is there's more virus in your nose when you get exposed, and so people who've been vaccinated can still get an exposure and have mild symptoms. The vaccine will protect you from severe symptoms and death, but that just keeps this virus out there. And the more it's out there and can jump from human to human, the more likely it is to become lambda or whatever other Greek letter you want to give it. Right. And it'll get and that one is either going to be more effective and more deadly, or it's going to be less effective and less deadly. And we don't know.
Right.
We have no idea
And that's really
until it
scary.
occurs.
It is.
And then what about with, we really didn't see it in the pediatric population with the, original surge unless, the child was immunocompromised, and that was still even rare.
Right.
But what are y'all seeing in your pediatric and teen population as far as
An absolute increase, and like you said, it was non-existent in the original COVID surges. We didn't see kids at all. It was a very rare circumstance. But now we're seeing it, and you've got kids coming in the emergency room, and you've got children at Our Lady of Lake Children's Hospital and at Ochsner Children's Hospital and Children's Hospital in New Orleans, and you've got children in the intensive care unit and having to be ventilated. And we're going to have probably some pediatric deaths in this pass.
and that is extremely scary.
I have a quick question.
Sure.
So it was previously said that if you had COVID, they wanted you to donate blood because you had the antibody. How long does the antibody actually last in your system?
It varies.
It varies.
It varies.
And then
About 90 days.
90 days.
That's the thought.
And I know people that have been vaccinated and they've caught it once or twice. They've, been vaccinated and then caught it once or twice. I know one person, a good friend of ours, who's gotten it twice.
You got a variant out there, but if you acquired immunity from an infection and then the virus mutates and now it's a different kind of virus, then you don't have immunity to that virus. So you're at an increased risk of getting it again. Whereas the vaccines tend to protect you from exposure to the new variants. And we were talking this afternoon, and you were asking me about the booster, and literally after we hung up, the federal government announced that we're going to go with the booster, and it's going to start in mid-September.
For
So that was your
everyone,
answer,
not
for
just for a
everybody.
couple of days ago when it
Wow.
said for immunocompromised. That's for everyone. We're going to have you back to talk because we're out of time. I knew we would have lots of questions for you, but we need to have you come back in the coming weeks, talk about what's
We
going
do,
on.
because this is gonna
especially when the
evolve.
booster is released and folks are supposed to be getting that. But thank you so much
We'll be happy
for
to be back.
enlightening us.
No
I
problem.
appreciate that. We've been talking with Dr. Ralph Dauterive with Ochsner Medical Center here in Baton Rouge, Louisiana. And up next, some music with Mr. Connor James.
That's
Playing in
right.
the background. That's great.